Page 1. The Department of Medical Examiner Coroner. Los Angeles, California on November 6, 2022 at 9:40 a.m. Autopsy report. Number 2022-11542. I performed an autopsy on the body of Aaron Charles Carter. From the anatomic findings and pertinent history, I ascribe the death to drowning, due to or as a consequence of effects of difluoroethane and alprazolam. Manner of death, accident. How injury occurred, submerged in bathtub after inhalation of compressed gas and intake of alprazolam. Anatomic summary. 1. Pulmonary edema and congestion. Right lung, 900 grams. Left lung, 850 grams. 2. No life-threatening traumatic injuries. Circumstances. According to investigative reports, this 34-year-old male was found submerged underwater and unresponsive in his bathtub. Medics responded and pronounced death at the scene. Please see coroner investigator's report for further information. External examination. The body is identified by toe tags and is that of an unembalmed refrigerated adult male who appears the reported age of 34 years. The body measures 69 inches, weighs 133 pounds, and is normally developed. The body habitus is thin. Examination of the skin shows no jaundice. No prominent scars are identified. There are numerous tattoos including butterfly on right forehead, prints under the right eye, karma above the left eye. Page 2. A Medusa head on the left face. A lion head on the right neck. A microphone on the right chest. A piano on the left chest. A microphone on the anterior right forearm. Flowers on the posterior right forearm. A cross, compass, and doves on the anterior left forearm. Piano keys on the posterior left forearm. A sun design on the upper mid-back. The scalp hair is blonde-brown and appears bleached. The facial hair is shaven. Examination of the eyes reveals brown irides and sclerae that are white. The conjunctivae are not congested. The oronasal passages are unobstructed. The upper and lower teeth are incomplete. Frenula and oral mucosa are intact. No petechial hemorrhages are identified. There is no chest deformity. There is no increased anterior-posterior diameter. The abdomen is not distended. The genitalia are those of an adult male. The external genitalia are unremarkable. The extremities show no edema or joint deformity. Evidence of therapeutic intervention. There is no evidence of therapeutic intervention. There has not been post-mortem intervention for organ or tissue procurement. Post-mortem changes. Rigor mortis is present. Livor mortis is minimal and in a predominantly posterior distribution. It blanches with firm pressure. Evidence of non-fatal injury. There is 1/8 inch abrasion on the superior aspect of the philtrum of the upper lip just below the base of the nasal septum. There is a 1/4 inch subungual hematoma in the nail bed of the right index finger. Page 3. Initial incision. The body cavities are entered through the standard coronal incision and the standard Y-shaped incision. Neck. The neck organs are removed en bloc with the tongue. No foreign material is present in the mouth, upper airway, or trachea. There is no edema of the larynx. Both the hyoid bone and the larynx are intact and without fractures. No hemorrhage is present in the adjacent throat organs, investing fascia, strap muscles, thyroid, or visceral fascia. There are no prevertebral fascial hemorrhages. The tongue one section shows no trauma. Chest abdominal cavity. No pleural effusions are present. Pleural adhesions are not present. The organs of the abdominal cavity have a normal arrangement and none are absent. Ascites is not present. The peritoneal cavity is without evidence of peritonitis. There are no abdominal adhesions. Systemic and organ review. Note, the following observations are limited to findings other than described above. Musculoskeletal system. No abnormalities of the bony framework or muscles are identified. Cardiovascular system. The thoracic and abdominal aorta have minimal atherosclerosis. There is no tortuosity or widening of the thoracic segment. There is no dilation of the lower abdominal segment. No aneurysm is present. The major branches of the aorta show no abnormality. The pericardial sac contains scant serous fluid. The heart weighs 340 grams. It has a normal configuration. Heart shape is not globular and the myocardium is not flabby. The right ventricle is 0.2 centimeters, the interventricular septum is 1.1 centimeters, and the left ventricle is 1.2 centimeters in thickness. The chambers are normally developed and are without mural thrombosis. The valves are thin, leafy, and appear competent. Page 4. No cardiac valve vegetations are present. There is no abnormality of the apices of the papillary musculature. There are no defects of the septum. The great vessels enter and leave in a normal fashion. The coronary ostia are patent, located at or below the sinotubular junction, and are centrally located within their respective sinuses. The coronary artery distribution is right dominant. Serial sectioning of the coronary arteries shows widely patent lumina in all the major segments and no significant atherosclerotic stenosis. Respiratory system. Scant secretions are found in the upper respiratory and lower bronchial passages. The right lung is 900 grams and the left lung is 850 grams. The pulmonary parenchyma is dark red-purple and the cut surfaces exude a large amount of frothy fluid. The visceral pleurae are unremarkable. The pulmonary vasculature is without thromboembolism. Gastrointestinal system. The esophagus is intact throughout. Esophageal varices are not present. The stomach contains approximately 325 cc of green-yellow liquid with fine, white, chalky particulate. The mucosa is unremarkable. The small intestine and colon are unremarkable. They contain non-formed stool. The appendix is unremarkable. There is no necrosis, hemorrhage or fibrosis. The pancreas. Hepatobiliary system. The liver is 1,850 grams and is brown red. The capsule is intact and the consistency of the parenchyma is semi-firm. The cut surface is smooth and homogeneous. There is no evidence of cirrhosis. The gallbladder is present. The wall is thin and pliable. It contains a moderate amount of bile and no calculi. Urinary system. The right kidney is 150 grams. The left kidney is 140 grams. The kidneys are normally situated in the capsule strip, easily revealing a surface that is smooth and glistening. The corticomedullary demarcation is preserved. The pyramids are not remarkable. The ureters are without dilation or obstruction and pursue their normal course. The urinary bladder is unremarkable. It contains approximately 10 cc of urine. Page 5. Genital system. The prostate is not enlarged and is without nodularity. Both testes are in the scrotum and are unremarkable. Hemolymphatic system. The spleen is 115 grams. The capsule is intact. The parenchyma is dark red and soft. The bone marrow of the ribs is unremarkable. Endocrine system. The thyroid, adrenal, and pituitary glands are unremarkable. The parathyroid glands are not individually dissected. The thymus is the usual appearance for the age. Special senses. The eyes are not dissected. The middle and inner ear are not dissected. Head and central nervous system. There is no subcutaneous hemorrhage within the scalp. The external periosteum is unremarkable. The dura mater is unremarkable. There is no epidural, subdural or subarachnoid hemorrhage. The dura mater is stripped, showing no fractures of the calvarium or base of the skull. There is notable red congestion within the mastoid air cells bilaterally. The brain weighs 1,510 grams. The leptomeninges are thin and transparent. A mildly flattened convolutionary pattern is observed. The brain is diffusely softened. Pons, medulla, and cerebellum are unremarkable. There is no evidence of uncal or cerebellar herniation. Vessels at the base of the brain have a normal pattern of distribution. There are no aneurysms. The cerebral arteries show minimal atherosclerosis. Coronal sectioning demonstrates a uniformity of cortical gray thickness. The basal ganglia are intact. Anatomic landmarks are preserved. Cerebral contusions are not present. The ventricular system has a normal appearance without dilation or distortion. There is no intraparenchymal hemorrhage. Page 6. Spinal cord. The cervical cord is examined through the foramen magnum and is grossly unremarkable. Evidence collection. None. Retained tissue. Representative sections from various organs are preserved in one storage jar. Histologic key. None. Toxicology. Samples of heart blood, femoral blood, liver, gastric contents, urine, and vitreous are submitted to the laboratory. An EDTA tube of heart blood is collected as a typing specimen. Special procedures. Done. Photography. No photographs were taken during the course of the autopsy. Radiology. No post-mortem radiologic examination was performed. Witnesses. There were no outside personnel present to witness the autopsy. Diagrams used. Diagram form number 20 was used during the performance of the autopsy. Medical examiner diagrams are not intended to be facsimiles nor are they drawn to scale. Page 7. Summary and opinion. This 34-year-old male, Aaron Carter, was found submerged underwater and unresponsive in his bathtub. Medics responded and pronounced death at the scene. Autopsy revealed marked pulmonary edema and no fatal trauma. Toxicological testing detected the presence of difluoroethane and alprazolam in Mr. Carter's system. Additionally, antihistamine and quetiapine metabolites were present. Difluoroethane is a gas commonly used as a propellant in air spray cleaners for electronic devices that can induce feelings of euphoria when inhaled. It is known to have cardiotoxic effects which can lead to cardiac arrhythmias and sudden cardiac arrest. Alprazolam, a benzodiazepine, has depressant effects on the central nervous system which can cause drowsiness and sedation. Based on the autopsy findings, investigative reports and circumstances, as currently known, Mr. Carter became incapacitated while in the bathtub due to the effects of inhaling compressed gas and taking alprazolam. This resulted in him becoming submerged underwater, unable to breathe, and ultimately led to his death. The cause of death is drowning due to the effects of difluoroethane and alprazolam. The manner of death is accident. Bryce L. Hunt, MD. Interim Senior Deputy Medical Examiner. April 14, 2023. Page 8. Diagram of Aaron Carter's body with notes pointing at various parts of his body. Some notable notes. 1/8 inch abrasion below tip of nose. Rigor present. Minimal posterior lower blanches. 1/4 inch nail bed hemorrhage. Body tag, CC 2.22 to 11,542. Page 9. Autopsy check sheet just goes through everything noted about his body and organs already discussed. Page 10. County of Los Angeles, Medical Report, Department of Medical Examiner Coroner. 2022-11542. Aaron Charles Carter. ACC 334. Age, 34. Gender, male. Autopsy class, B. Date, November 6, 2022. Time, 9:40 a.m. Dr. Hunt. By, Hunt. Death caused by. Immediate cause, drowning. Due to, or as a consequence of, effects of difluoroethane and alprazolam. Accident. If other than natural causes, how did injury occur? Submerged in bathtub after inhalation of compressed gas and intake of alprazolam. Was operation performed for any condition stated above? Oh yes, no. Type of surgery, no. Technician, M. Hernandez. Pregnancy in last year, not applicable. Prior examination review by DME. Body tag. At scene photos. Typing specimen. Collected by, BH. Source, heart blood. Toxicology specimen. Heart blood. Femoral blood. Stomach contents. Vitreous. Liver. Urine. Toxicology requests. Screen, C. Other, volatiles, difluoroethane. Requested material on pending cases. Tox for cod. Page 11. Department of Medical Examiner Coroner, County of Los Angeles. Forensic Science Laboratories. 1104 North Mission Road, Los Angeles, California 90033. Laboratory Analysis Summary Report. Hunt, Bryce MD. Deputy Medical Examiner. 1104 North Mission Road. Los Angeles, California 90033. Coroner Case Number, 2022-11542. Decedent, Aaron Charles Carter. Pending tox. Alcohol quantitation confirmation. Specimen, blood heart. Drug, ethanol. Result, negative. Drug screen. Specimen, blood heart. Drug, benzodiazepines. Result, presumptive positive. Drug, cocaine and metabolism. Result, not detected. Drug, fentanyl. Result, not detected. Drug, methamphetamine and MDMA. Result, not detected. Drug, opiates, codeine and morphine. Result, presumptive positive. Drug, opiates, hydrocodone and hydromorphone. Result, presumptive positive. Drug, opiates, phencyclidine. Result, not detected. Drug screen confirmation. Specimen, blood heart. Drug, hydroxyzine. Result, not detected. Drug, norchlorhializine. Result, 0.24 micrograms per milliliter. Drug, quetiapine. Result, not detected. Drug, quetiapine metabolite. Result, present. Drug, alprazolam. Result, 93 nanograms per milliliter. Drug, codeine, free. Result, not detected. Drug, hydrocodone, free. Result, not detected. Drug, hydromorphone, free. Result, not detected. Drug, morphine, free. Result, not detected. Drug, oxycodone, free. Result, not detected. Drug, oxymorphone, free. Result, not detected. Drug, difluoroethane. Result, present. Page 12, Screening Key. Page 13. County of Los Angeles. Medical Evidence. Department of Coroner. Case 2022-11542. Decedent's name, Aaron Charles Carter. DOD, November 5, 2022. Page 1 of 2. Drug name, alprazolam. Date of issue, August 16, 2022. Number issued, 60. Form, tablet. Dosage, 2 milligrams. RX directions, 1-2 times daily. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, gabapentin. Date of issue, August 27, 2021. Number issued, 150. Form, capsule. Dosage, 300 milligrams. RX directions, 2 twice daily, 1 bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, gabapentin. Date of issue, August 16, 2022. Number issued, 150. Form, capsule. Dosage, 300 milligrams. RX directions, 2 twice daily, 1 bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, gabapentin. Date of issue, July 17, 2021. Number issued, 150. Form, capsule. Dosage, 300 milligrams. Rx directions, 2 twice daily, 1 bed. Physician, Faber, J. Drug name, gabapentin. Date of issue, March 30, 2021. Number issued, 150. Form, capsule. Dosage, 300 milligrams. Rx directions, 2 twice daily, 1 bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, gabapentin. Date of issue, November 27, 2021. Number issued, 150. Form, capsule. Dosage, 300 milligrams. Rx directions, 2 twice daily, 1 bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, gabapentin. Date of issue, January 25, 2022. Number issued, 150. Form, capsule. Dosage, 300 milligrams. Rx directions, 2 twice daily, 1 bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, gabapentin. Date of issue, February 22, 2022. Number issued, 150. Form, capsule. Dosage, 300 milligrams. Rx directions, 2 twice daily, 1 bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, hydroxyzine. Date of issue, December 24, 2021. Number issued, 60. Form, tablet. Dosage, 50 milligrams. Rx directions, 1 every 12 hours. Physician, Faber, J. Pharmacy phone comments, Walgreens. Paraphernalia description. Tablet organizer with multiple pills. Alprazolam prescription medication bottle for Taylor Helgeson empty. Investigator, Marlene Navarro, 604249. Date, November 4, 2022. Page 14. Page 2 of 2. Drug name, hydroxyzine. Date of issue, January 25, 2022. Number issued, 60. Form, tablet. Dosage, 50 milligrams. Rx directions, 1 every 12 hours. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, ondansetron. Date of issue, June 9, 2020. Number issued, 30. Form, tablet. Dosage, 4 milligrams. Rx directions, 1 daily. Physician, Bermany, Pharmacy phone comments, CVS. Drug name, propranolol. Date of issue, November 27, 2021. Number issued, 90. Form, tablet. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, quetiapine. Date of issue, June 12, 2022. Number issued, 14. Form, tablet. Dosage, 50 milligrams. Rx directions, 1-2 at bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, quetiapine. Date of issue, September 15, 2022. Number issued, 60. Number remaining, 2. Form, tablet. Dosage, 50 milligrams. Rx directions, 1-2 at bed. Physician, Faber, J. Pharmacy phone comments, Walgreens. Drug name, trazodone. Date of issue, August 16, 2022. Number issued, 30. Form, tablet. Dosage, 50 milligrams. Rx directions, 1 every night. Physician, Faber, J. Pharmacy phone comments, Walgreens. Page 15. Identified by name, comparison to Calfado. City, Lancaster. Date, November 5, 2022. Time, 1700 hours. Place of death, place found, residence. At work, no. Date of death, November 5, 2022. Time, 11:14 a.m. Found or pronounced by, Lacktham 84, Tracy. Other agency INV. Officer, Last Lancaster, Deputy Vannersdale number 611. Report number, 022-19082-1159-496. Transported by, Dustin Miranda. 2, Los Angeles FSC. Date, November 5, 2022. Time, 21:12. Fingerprints, yes. Clothing, yes. PRPT, no. Mortuary, tulip cremations. Med. Ev, yes. Invest. Photo, 86. Seal type, not sealed. HOSP RPT, no. FIS. Ev, no. Evidence log, no. Property, yes. HOSP chart, no. Suicide note, no. RCPT, no. 338,731. Synopsis. The decedent is a celebrity with a known history of substance abuse. The decedent had multiple interactions with local police relating to the substance abuse. The decedent was last known alive on November 4, 2022 at about 200 hours when police were called for a welfare check after the decedent was reportedly seen heard to be huffing on the social media platform Instagram via live stream. Deputies responded to the decedent's home and made contact with the decedent, whom told them to leave. On 11/05 at around 1100 hours, the decedent's housekeeper knocked on his door to offer him coffee. When she got no response and after hearing the dogs barking, she let herself in and found the decedent fully submerged in the bathtub. The decedent was reportedly in the fetal position but supine, face up, with his hands curled into his chest. The jets were on in the bathtub. She called 911 and was instructed to pull him out and perform CPR. Death was determined without medical intervention by paramedics at the SCNI. One of the duster cans of Surf-On electronic duster were found scattered in his bedroom and bathroom. The nozzle tip to one of the duster cans was found in the front pocket of a sweatshirt found near the bathtub. The decedent had a known history of inhalant abuse and had relapsed at some point this year. The decedent was supposed to check in with his outpatient drug counselor on 11/04 at 1800 hours but missed the phone appointment. There was no obvious suicide paraphernalia found at the scene. The decedent's fiancé and his mother both stated that the decedent was not suicidal and made no ideations prior to his death. Multiple bottles of prescription medication were found throughout his bathroom and were collected. The body exam found no obvious evidence of suspicious trauma. There is no suspicion of foul play at this time. The decedent's rigor mortis appeared to be 3/4, lividity blanched with firm pressure. The decedent was wearing a t-shirt and necklace. His sweatshirt, beanie, pants, and socks were seen on the floor near the bathtub. The bathtub water was green and had a foul odor. Investigator, Marlene Navarro. Date, November 5, 2022. Time, 2022. Reviewed, Amy Earl. Date, November 5, 2022. Time, 2028. Form number 3 narrative to follow. Page 16. Case report. Apparent mode, accident. Special circumstances, media interest. Case No. 2022-11542. Crypt, 334. Last, first, middle, Carter, Aaron Charles. City, Lancaster. State, California. Zip, 93536. Sex, male. Race appears, Caucasian. DOB, December 7, 1987. Age, 34. Height, 69 inches. Weight, 133 pounds. Eyes, brown. Hair, blonde. Teeth, all natural teeth. ID view, yes. Condition, fair. Mark type, tattoo. Mark location, cheeks. Mark description, love prints. Mark type, tattoo. Mark location, right eyebrow. Mark description, butterfly. Mark type, tattoo. Mark location, left face. Mark description, female face. Page 17. County of Los Angeles, Department of Coroner. Investigator's narrative. Case number, 2022-11542. Decedent, Aaron Charles Carter. Information sources. Deputy B. Vandersdale 611164, Los Angeles County Sheriff's Department, Lancaster. Detectives Sanchez and Lugo, Los Angeles County Sheriff's Department Homicide Bureau. On-scene investigation. Investigation. This death was reported to our office on November 5, 2022 at 12:16 hours as a first call. I was assigned the call at 16:40 hours by Investigator Benavides Paraz. I arrived to the scene at 16:51 hours and cleared the call at 18:40 hours. The decedent was transported to the Forensic Science Center by forensic attendant Miranda. A routine manual search of the JDIC system using the decedent's name and date of birth found no record. Criminalist call-out criteria was reviewed and not met for this case. Location. Place of injury, unknown. History of prescription medication abuse and inhalant abuse. Place of death, residence. Informant witness statements. Deputy Vandersdale and Detective Lugo and Sanchez gave me the following information. The only people in the residence at the time of this 911 call were the decedent and his housekeeper. On November 5, 2022 around 1100 hours the housekeeper knocked on the decedent's door to offer him coffee. The dogs were barking inside the room, but she got no response from the decedent. The housekeeper grew concerned and decided to open the door. The decedent's dogs ran towards the bathroom and the housekeeper found the decedent in the bathtub. 911 was called. The dispatcher told the housekeeper to pull the decedent out and perform CPR, which she reportedly did. Deputies from the Los Angeles County Lancaster Station and paramedics from the Los Angeles County Fire Department Engine 84 were dispatched to the scene. Death was determined without any medical intervention at 1114 hours by paramedic Tracy. According to the housekeeper, the jets in the bathtub were on. The decedent's feet were pointing north, and his head was pointing south. The fireplace in the bedroom was also on. Measurements of the bathtub were conducted by LASD FIS Roswell number 451513. The bathtub measured about 2.5 feet, width, by 5 feet, length. The depth was measured at about 13 inches. Several compressed air canisters were found throughout the decedent's bedroom and were collected by FLS Roswell. The decedent is known to local law enforcement due to multiple calls for service at this address. About a week prior, the decedent's fiancée had called requesting deputies conduct a welfare check on the decedent because she believed he was under the influence while driving his RV. Deputies made contact with the decedent. He was not arrested for driving under the influence. On November 4, at around 0200 hours, deputies were dispatched to the residence for another welfare check after the decedent was believed to have been huffing on an Instagram live stream. The person who called it and thought he might have become unresponsive. Deputies from the LASD Lancaster station made contact with the decedent. The decedent was inside his home and yelled at them to get out from the stairs. Deputies left the residence. According to the decedent's housekeeper, this was the last time she saw him alive. Sensor gave me the following information. She last had contact with the decedent on November 3 at 1938 hours. She and the decedent were arguing via text. She left their residence on October 31 around 1500 hours to spend time with their son. She usually returned home to the decedent after a few days, but lately she had been staying away because people were showing up to take photos of them. Sensor texted the decedent on November 4 at 23:10 hours but never got a response. The decedent was supposed to have a phone session with an outpatient drug counselor on November 4 at 1800 hours but missed it without any explanation. The decedent had a history of Xanax abuse and inhalant abuse. They've been together 3 years. The decedent relapsed this year. There are no known suicide attempts and no suicidal ideations. Scene description. The decedent's residence was scarcely furnished. Most of the furniture was in the garage. The decedent's bedroom and music room appeared to be fully furnished. The decedent's bedroom was messy, the nightstands were dirty and the drawers were in disarray. There were air canisters on the bed and in the bathroom. Multiple bottles of prescription medication were found in the drawers and an unlocked safe found in the bathroom. There was fecal matter in the closet. The water in the bathtub was green and there was grime around the eddy of the tub. The decedent was seen lying supine on the floor next to the bathtub. His feet were pointing northeast and his head was pointing northwest. There was grimy water on the floor underneath and around the decedent. There were 2 towels folded up on the floor between the bathtub and the decedent's body. The decedent's clothing, pants, sweatshirt, beanie, were found underneath the bathroom vanity near the decedent's feet. The nozzle to one of the duster cans was found in the front pocket of the sweatshirt found on the floor near the decedent. Evidence. I collected prescription medication. See evidence log. Body examination. The decedent is a male Caucasian adult with brown eyes, blonde hair, an unshaven face, and apparent natural teeth. He was wearing a beige shirt. He had several tattoos, some of which were prints in love on his cheeks, a butterfly above his right eyebrow, a female face on the left side of his face. There was a small abrasion on his left eyebrow and a small abrasion at the base of his septum. No obvious evidence of suspicious trauma was noted. Rigor mortis appeared to be 3-4 and resolving. Lividity blanched with firm pressure. Identification. The decedent was positively identified by visual comparison to his California driver's license as Aaron Charles Carter, date of birth, December 7, 1987. Next of kin notification. I spoke to the decedent's mother and she confirmed the decedent was not married and has a minor child. Tissue donation. The decedent is not a viable candidate due to the condition of his body. Autopsy notification. No autopsy requests. Marlene Navarro. Date of report, November 21, 2022.